Okay, so Dr. Bessel van der Kolk, thank you so much for agreeing to be interviewed. It's an honor to have you on board and speaking with us today.
Thank you.
So I've got so much I wanted to ask you about on such an important topic. And I've been talking a lot about trauma, emotional trauma, the adverse childhood event studies. But I think still people have this idea about the word trauma, and they have a very narrow experience of what trauma is. So they don't always think that it applies to them. When we say trauma, they often think of maybe what war veterans have been through. They might think of physical or sexual assault, or perhaps car accidents. But I think it's much bigger than that. And perhaps you can share, the kind of the spectrum of what trauma really is, and kind of the prevalence of it as well.
Okay. You want me to start there?
Yes, go.
Well, the study of trauma and the concept of trauma in our generations recently does come from soldiers, because we live in this military-industrial complex. We go to war all the time. These guys come home, and they have these VA hospitals and research projects, and so the focus is on the military. But I found very early in my research with Vietnam veterans is that the issue of relationships is a very core one. And the issue of relationships was sort of left out of the whole concept of trauma. And it turned out in the work that I did is that most of the traumas occurred in the context of people letting you down, people betraying you, your best friend having been killed, you going on a rampage and hurting people. And so I was from the very beginning impressed with the social context and how we are social creatures. And then people started to look at childhood trauma, and the ACE study came out, and they talked about specific events. But what slowly emerges out of the work that we are all doing is that at the end, the quality of the safety of the relationship with your caregivers and your loved ones trumps the issue of trauma. And so it's not the event per se, although the event per se can be horrendous and profound, but it's also who is there for you when it happens, who is the person who inflicts this upon you. And so what the ACE study leaves out, it had to because of a gigantic epidemiological study where they asked people just to answer a few questions, is the whole issue, who do you feel safe with growing up? Who was there for you growing up? Who cuddled you and held you when terrible things happened to you? Who was there for you? And as so the research is emerging slowly, it turns out who was there for you at the time is even more profound than what happened to you at the time. And so the issue is that we are interpersonal creatures. We are primates. We're like monkeys in a zoo. We don't exist independently from each other. And when our little troops are playing with each other and they're all taking care of each other, we can tolerate a lot of stuff, including we can tolerate a lot of stuff from our relatives. It can be difficult and hard to deal with. We never put up with people at work who behave as badly as our relatives do, but because we're part of this troop, and as long as the troop is basically okay, we can tolerate a lot of stuff. But if the troop abandons you, if you're left by yourself to your own devices, if somebody in the troop molests you, or secretly beats you up, or blames you for what's happening, and you get to be an outcast, that becomes a very big issue. So the issue of who is there for you, who is trying to protect you, who is there for you when you are wounded, is sort of the critical issue, or one very critical issue.
So this is fascinating. Would it help to speak to the difference between a diagnosis of actual pure PTSD and what you've been describing as developmental trauma? Does that speak to some of that?
It's how we talk about it as we try to put it into our little pages of the DSM.
And what would be the symptoms, the differences in the symptoms of somebody with pure PTSD versus people with symptoms of more of the developmental trauma?
So the pure PTSD is more like something keeps coming back. You keep behaving and acting and reacting as if it's still going on. So basically your mind, your brain, your body gets stuck in a particular event. We know how to treat that quite well, actually, these days. In our EMDR study, we had an 80% cure rate. In our MDMA studies, we now also approximating 80%. So single incident, one-time stuff is relatively simple to deal with, and the technology for that is largely taken care of. Particularly the audience that you also talk about, the chronic physical illness, and your body getting all uptight, your body holding stuff. That's oftentimes more relational trauma, where you don't feel seen, you don't feel responded to. The whole issue of reciprocity, I'll be there for you, you'll be there for me, sort of breaks down. And there is this sort of pervasive sense of alienation and loneliness, of at the core of me is defective, and I can't stand who I am. I live in a body that's disgusting, that's miserable. So it's interesting to me, actually, that you're very much into the ACE study, and I love Vince Folletti, and I love the study, but when I look at the study, what I see is that a lot of the things that they uncovered in the ACE study, continuing to smoke, taking drugs, becoming obese, are issues of self-care. Okay? If you love your body and says, hey, take no heroin, you go like, sounds interesting, but I have a body that I sort of like to take care of. How about no smoke? Nah, I like my lungs and I like to live for a long time, so I'm not going to smoke. And so if you have a relationship to your body, of the body that you love, you don't do all these high-risk behaviors. But when you get ignored and nobody's there for you, you feel it in your body as heartache and gut veg. Darwin already wrote about it way back 150 years ago. So emotions, a stuck emotion gets stuck in your body in a way. And it gets stuck in that body-mind axis. And so your body goes berserk. It gets played out in the theater of the body. So, like I have some grandchildren these days, and what really strikes me is that what do parents do? The kids are crying all the time. The kids are falling on the floor all the time. They're always falling off the little tricycles. And what do parents do? They hold them and they rock them and make them feel better. And so they restore that balance in their bodies. And I think a lot of the issues that you are interested in is the body getting stuck and not feeling safe and not feeling taken care of.
Oh, this is profound because, as I mentioned, a lot of people sort of just think of trauma as like these one-off events, whereas
Right.
what we're actually saying is that people have been talking about silent ACEs, which is, it's just, emotional abuse, emotional neglect, not being seen, like, as you say, that leads to things like cause shame. And I actually think, in my experience and what I'm seeing, is that that's almost more devastating. Like, cause shame and emotional trauma, it's almost worse than having a physical thing happen, because at least if it was physical, people could see it's grounded in reality. Whereas if it's just, say, a form of emotional abuse, it's more invisible. Have you found that? Or
Well, no, I think rank ordering, I do it sometimes also, is a bit of a dangerous thing to do. Like, I'd rather have been gang raped than being ignored by my mother.
okay, I didn't want to minimize.
I do the same thing sometimes. So it's a different effect. It's a sense of unworthiness that comes with it. So that you're not worthy of being seen, not worthy of being known. You're on your own. So it's a very pervasive sense of alienation, loneliness in a way, where your body is protesting. Your body is basically crying out. So to my mind, the core issue is caught very well with this notion of don't cry, I'll give you something to cry about. So here you lift up your face and say, please don't hit me. And instead of the person sort of reciprocating, I said, oh, I feel so bad about it. Let me take care of you. You get slapped. I said, just keep it to yourself, stick with it, hold it, and just you process your own misery inside of yourself. And the trouble is that we are much better in dealing with specific traumas than to deal with the sense of disconnection and not feeling seen and not being known.
And that's pretty devastating. That's also, it seems to, it's very devastating. And it seems to, it not just, yeah.
And pervasive in society also. And I'm very worried about our cell phones and our iPads sort of really diverting us further away from talking to each other, interacting with each other, and stuff like that.
Yes, this is big. And the official ACEs questionnaire was really, it was too superficial to elicit that kind of
Yeah,
relational trauma.
yeah. And I certainly don't want to criticize the A study in any way. Uh, they were looking at that particular piece and getting the lay of the land. And they got a very good lay of the land. It's pervasive, it's intense, it happens to large numbers of people. And one of the things, best things about the A study, it was done on a white college educated population. So you can no longer say, oh, this happens to these people in the slums, it happens to the people over there. It was a representative sample of pretty well off people by and large.
Yes. Okay. And if we start talking about some more of on the mechanism side, like, so how does this childhood biography become adult biology? In your book, which is the brilliant name, The Body Keeps the Score, you're really hinting that what goes on emotionally and mentally is reflected in the body. In other words, the mind and body really are one thing.
Yeah. First to say that one. So the other thing that is very important, and mainstream doesn't pay much attention to, your brain, my friend Bruce Perry says about, the brain is a use-dependent organ. So our brain structures is based on experience. And so if your experience is, I am not seen, I'm not known, I don't know how you're going to react to me, that affects certain brain structures. If you know, I'd like to show, I always show videotape of that, if you get upset and you know that your mom will come and make you feel better, you get an internal sense of timing of, oh, I can really feel like crap, but before too long, somebody will come to my rescue. And if you don't have that internal experience, you get this internal feeling when something bad happens to you, this will never go away. So life is tough for except we live in Los Angeles, for everybody else, life is tough a good amount of the time, and crap happens to people all the time. But if you have an internal sense of, this too shall pass, because way back everything always passed, even though I felt very bad some of the time, you get an internal sense of, this will go away, so I can deal with this. But if the caretakers aren't there for you, you get this internal sense of, this will last forever. And the only way to make it come to an end is by taking drugs or getting surgery or doing something drastic, because the capacity of the interpersonal world to take care of it is not only in your mind frame, but in fact it may be harder for the interpersonal frame to take care of it. So if I get upset by whatever, I interview possibly, I'll go to my wife, who's actually very nice to me, and I say to her, I had this horrible interview. I said, oh, honey, don't listen to the person. so there's something about our interactions that will make it go away and make it pass. But if your internal frame is like, oh, this will never go away, then I may get drunk after a failed interview.
So you're saying, which is, it still shocks me that we're talking about a neurological change in the brain, in the structure of the brain in response to what you're saying, causing that cascade of stress symptoms, and then that changes the epigenetic expression in the biology, and that's where we're talking about it leading to physical illness, right?
Yeah.
So, and it still shocks me so much that we're talking about these neurological changes, and yet we still treat people who are addicts as such as criminals, behaviorally challenged people as are punished. People with chronic fatigue were treated like they had deviant psychiatric behavior, and it's incredible.
Don't make the doctor feel helpless. Whatever you do, don't make your doctor feel helpless. Huh?
Okay.
Notice from going to medical school, if you make your doctor feel helpless, they will take it out of you.
Okay. Yes.
So you have a clear thing that helps your doctor to say, oh, this is what's going on with this person. Let me give the right treatment. But if you make your doctor stretch his head and make him feel helpless, they may not take it so well.
Yes, I think there's a lot of people who know not to to badly react with their doctors. It's very true. So another thing we see in the community of people with sort of burnout, chronic fatigue, fibromyalgia, we see these tendencies to perfectionism, overthinking, overachievement, overgiving, which is all at the expense of self. And that comes back then to this core issues of self-worth and shame that causes these burnout behaviors.
Yeah. See, what strikes me, and that's why I gave part of why I gave my book the title it did, How the Body Keeps the Score, is that if it's in the body, the treatment should be in the body.
Yes.
But body treatment is somewhere like way out of the periphery of the world. And so inhabiting your body and feeling safe in your body. And we sit in a chair and we talk to people, and then we somehow try to magically make people feel safe in their body. And you cannot magically get that by yakking.
Yeah, now let's talk about healing by yakking.
Well,
because CBT, I was just exactly going to ask you about this.
CBT, I get too emotional about it.
I was going to say, but it's the official treatment plan for chronic fatigue, and it's very unpopular. Only 30% of people say they get any benefit. It's a huge dropout rate. Can you talk about like the limitations of rational approaches?
I do CBT with my wife all the time.
Okay.
Point out the error of her ways. And she always says, "Oh, honey, thank you for pointing out my stupid way of thinking about things. And you're so much wiser than I am, and I'll adopt your view." Oh.
But it doesn't change the behavior.
I know what you say. So the issue is you need to experience your body. You need to feel safe in your body. And that means that you should introduce the issue of touch. Traditionally, nurses used to touch. I think they touch less and less, but they were taught how to touch. And they were the people who always made people feel better, actually. But that now is far from the mainstream. And see if your insurance company will pay for your cranial sacral therapy, or for your Feldenkrais, or for something having to do with moving your body and actually feeling how your body interacts with its environment. Yoga. So we did the first NIH-funded study on yoga, and found that it is more effective for chronic PTSD than any drug that people have ever studied. I didn't see a single drug psychopharm office turn into a yoga studio after we published this data. But this data is serious. Like, if you learn how to really regularly inhabit your body and learn to feel comfortable in moving your body and being in your body, something starts shifting.
That's so critical. It's phenomenally important what you're talking about, these bottom-up body approaches. A lot of people are also, by the way, find it really difficult to meditate. A lot of the group that I work with, they just can't, they're actually not, I realize they're not in their body. They're in their head, in anxiety, and they can't sit and meditate. So that's the group that needs to do the body work.
Say meditation would be contraindicated for chronically traumatized people, because the trauma is not about an event that happened a long time ago. It's about something living inside of yourself now that used to be outside. And so now, when you're traumatized, to try to distract yourself all the time from all that crap that's inside of you. And if you ask somebody to just sit there and be still, the demons start coming out. Right? So that's why I think things like Qigong, Tai Chi, yoga might be much more useful, because you actually need to focus on making the right movements. So while you still go inside of your body and activate these critical brain areas of the temporal parietal cortex and insula that have to do with the owning of yourself, you don't have to be still and allow the stuff to bubble up.
Great. And are there certain interventions that you would say are more suited to these singular one-off events, and are there some treatments that are better for the relational trauma?
So EMDR, for example, is great for single incident trauma, the eye movement desensitization. In our study we had an 80% cure rate in people who had a single incident adult onset trauma, like a few weeks. That took care of it. So it's no longer a major treatment challenge. Then we did it on people with chronic childhood trauma, largely relational, and some people got a little bit better, some people got a little bit worse. And then people who practice EMDR only said, oh, you're doing it wrong because we cure everybody like that. But the EMDR said, no, you don't. That's not what the data show. Huh? And so this is not about a memory. This is about an imprint of I'm not seen, I'm not being known, and I know no comfort inside of myself. Huh? So I would say that the answer for not knowing comfort is to learn about comfort. So the exploration is because one size doesn't fit everybody. Huh? For example, I happen to really like yoga, but I hate Tai Chi.
Okay.
And the next person hates yoga, loves Tai Chi. And so what's right for you? And what's the right body treatment for you? And so it's always an issue of exploration of my body feels calmer with this person, or when they do that particular thing. So you need to find something that it's the last thing you want to do is to do something with your body. So in my upcoming conference, for example, one of the heroes of my upcoming conference is Matthew Sanford, who was in a severe car accident at age 13, and which caused him to become a paraplegic. He's a paraplegic yoga teacher.
Wow.
And his books are spectacular, of a guy who really had every part of his body that is still somehow movable and functioning. And I just admire him tremendously. And so even though your body hurts, you still need to live with your body and go there. Your natural inclination is to go the other way. There's a lot of people, like who you described, will say, no, but my body hurts too much when I do yoga. And then the question is, well, then you should have somebody who can just help you to you can.
Fascinating.
The natural inclination with all trauma is to guard against it. It's too overwhelming, it's too painful, which it is, to go back there. So you try to run away from it as fast as you can. But the reality is you need to slowly own it and live on the edge of exploring it, feeling it. So it's always a great courage, actually.
Right. Yeah. Okay. And just some of the other interventions. Are you still a big fan of neurofeedback?
Well, I don't like when people say fan. I'm a researcher also. Like I research neurofeedback.
Okay.
And so neurofeedback, and neurofeedback is particularly we're studying the most treatment-resistant population, kids who have been moved from foster home, people with horrendous histories of abuse and neglect, and their brain is always on fire, or their brain is always shut down. And so, with neurofeedback, you can help people to activate certain brain tracks of aliveness and engagement.
Okay, so it is something you recommend, but would you say it's quite difficult? The challenge right now is finding practitioners that are well trained. Is that?
Yeah, I barely know anybody. Most people I refer for neurofeedback come back with very disappointed.
Really?
The treatment they receive. Because I think people are not very aware in neurofeedback community what they're dealing with, actually. There's people with these DSM categories, panic reaction, autism, like these little labels. But it's not about a body that feels unsafe.
Right.
It then doesn't have that category.
Right.
And so I'm trying to treat a generation of neurofeedback people.
Okay.
Yeah.
So that's still one of the challenges with that intervention at the moment. Then, in terms of people who obviously want to look at ways they can start to feel safer in their body, do you still use EFT or recommend EFT?
I tap.
Yeah, tapping.
Which is a very old technique, and so that gets packaged as EFT.
Yes.
But it's basically tap acupuncture. It's one way of helping people calm down. It's just a little technique.
Yes. Okay. So it can be useful in some circumstances.
Yeah, I use it all the time. It's very helpful, but it's a little technique. It's not like,
Yes.
oh, if you have fibromyalgia, if you do a little tapping, you'll get cured. No, it's something that you may find helpful as a part of the whole deal.
Okay. And can people really, if they've had this pervasive sense of this loneliness, this core shame, they've had that their whole life, is it really possible to transform that? And have you seen
Yes, we
that?
see it, and I think they're well-known people, like Oprah Winfrey, to some degree, accounts for a childhood like that. So there's people who have been there. Some of my patients really have come a long way, but it's a long journey.
So
It's a journey of incredible courage, and one of the hard things also is for people to say this isn't working. Because when you have that background, you're so uncertain about yourself, and so people oftentimes stay too long in things that they know isn't really working, but they feel so lost. To say to somebody, "No, thank you very much, this isn't working. I'm going to do something else," is a very scary thing to do. And one thing that I really encourage is, to some degree, of has a downside also, is survivor groups. People who can support each other in their explorations. But it has its downside also, because you get very intense people who have very strong opinions about things.
I was going to just ask you about. There's always a study that I quote, and it's a meta-analytic review. It's a landmark study in 2004 of over 300,000 adults, where they found that social support was a stronger predictor of survival than physical activity, body mass index, hypertension, air pollution, alcohol consumption, and even smoking 15 cigarettes per day. And that really speaks to the power of social relations. And you kept hinting of it. Humans don't exist in a vacuum, right?
We're social creatures. But one of the things that trauma does, it makes you shut down, or it makes you overreact. So you're not the easiest person to deal with. So saying to a traumatized person, just have deep love and deep social relationships and good luck to you, easier said than done. Because when you're always suspicious and always on edge and you're always jumping out of your skin, it's very hard to have an easy relationship with somebody. That's why groups are important, to know that we're imperfect people and we can support each other in our imperfection.
Yes. So this aspect of recovery and healing in the context of social relations is gigantic.
Yeah, it is.
Basically.
So, but the social relationship for you it's interesting, because there was a study in Israel, for example, looking at 3 levels of religious communities after a Scud missile attack. Turned out the most fanatical religious group did best.
Wow.
Doesn't mean that you can become a religious fanatic in order to overcome your trauma. But it's very clear, if you have a deep belief and you have a community that shares your belief with you, life becomes much easier.
That's amazing. Yes. So the biggest problem is OP, other people. So it's not actually car accidents. It's actually other people are the cause and part of the healing.
Yeah, I think that's the nature of us as a weird species. We hurt each other and we heal each other.
Okay.
And we've never figured out how to do that in the right way.
Yes.
But people do hurt each other.
Yes, I was reading about people there's many people who prefer their pets than other people.
I think find it an understandable and sometimes laudable position. And I hang out with people who do canine therapy and equine therapy, and I think it can be extraordinarily helpful. I'm a great fan of it. But in the end, you probably have to hang out with people who belong to our species.
Yes, we really want to heal. Yes. Can I just ask you finally on a few other interventions and therapies, like psychomotor therapy or sensory motor psychotherapy and somatic experiencing? Are they tools that you still?
There's very different things, actually.
Yeah, they are actually. Yeah.
I'm a great fan of somatic experiencing, and of Peter, who's a good friend, and of sensory motor therapy, and Pat Ogden, who's a good friend. And I think they're doing wonderful things. The psychomotor is something else. It's psychodrama, which I happen to do, which is also good. They all do somewhat different things. It's a little bit too complex to go into right now. But basically, I think, uh, you know, uh, for me personally, my own growth and development, meeting Peter Levine first, and I met him at the same time, uh, really, really changed my whole orientation. And also, it was very, personally, very important for me as a healing person. I think what I learned from them is incredibly profound and important.
Wow. Okay. And it's just as some final comments then, just what are you most interested in terms of your research of what are the most promising therapies? Is it, what would you say, the most promising and that you're excited about researching?
I'll answer the question, but I'll first say something else. I am shocked by how few people do good therapy. And
Right.
so, if you say what your wish list would be, first of all, I wish people would learn what already exists.
Right.
Learn to work with the body, learn the current body techniques, learn neurofeedback, learn EMDR, just because there's a lot of things that are extremely helpful that are still very difficult to come by.
Right.
And then, of course, I like to also be on the cutting edge always. And so I think neurofeedback is very promising, but I've had a hell of a time getting funding for my neurofeedback research, even though we have had very good results. Uh, Very, very striking actually, with really spectacularly good results, and yet the funding is becoming, which is silly. And I'm also right now involved in a psychedelic study. Uh, and I think psychedelics can be extraordinarily helpful.
Wow. So, sort of plant medicines, psychedelic, that's very interesting. So, the kind of, you're talking about things like
Actually,
ecstasy.
MDMA, that's the study we're doing, yeah.
Okay, and you're finding that's having profound
Well,
results.
we haven't had not enough subjects ourselves yet, but I know from what's out there and what the research up to now, it's very promising. What it will
Fascinating.
do for the somatic part, I don't know. I mean, part of the reason why I wanted to study is to actually explore how well it takes care of this developmental trauma piece. Uh, and if it really changes people's relationship to their bodies, for example. I don't know that for sure.
Right.
That's to be explored.
Yeah, or whether it makes a lasting difference, because you can sort of have a short-term experience, but it might not
It really
last.
makes a difference in terms of people being haunted by terrible events. And the early research is really quite, it's clear, it sort of has established that more or less, to my satisfaction. What we don't know is how deep it goes to also take care of that uptightness and not having a relationship with your body. We don't know that at this point.
Right.
These are the questions we have.
Okay. Okay, fascinating. Okay, and I suppose, it's it's incredible. I'm still overwhelmed by the data and the information about that's coming out about the epidemic levels of childhood trauma. How we treat our children is this kind of sign of how civilized we are as a society, right? Would
No,
you
the
say?
sad thing actually is that things are worse today than they were 20 years ago.
Do you think really that?
Question about it. Look who's our president. And
Yes.
that's okay to say the things that he does.
Yes.
And we fought this abortion struggle about women being in charge of their own bodies. And that's in danger. And I said, no, I'm actually very perturbed by where we're going with all this.
Really, I was going to ask you because I was well, I was hoping that it's more to do with these truths, hidden truths are now coming to the surface, if you like. So it all looks much worse because like even the Me Too campaign is like very relevant to what you deal with and what we're dealing with the trauma and causes and health, and it's coming to the surface. And I was hoping, I had this hope that it's because truths are coming out, that like the true extent that was always there, it was always there for many, many years, but people are starting to see it now, the whole truth, and it looks worse than ever.
Well, I hope you're right. I actually, uh, I'm I'm alarmed actually.
Are you really right now? Just mainly with the politics, or?
No, also the politics of medicine. I mean, there's this fringe element that you and I would both belong to, that's into the body and self-care and stuff. But I'm not sure if that's mainstream.
Not at all.
I hope.
Yeah.
I totally hope I'm wrong. I totally hope I'm wrong. But I see very alarming things.
Yeah, even the medication of children, the medicating of children is one example. It's for those of us who know, like there's just this massive lack of understanding, isn't there, about the causes of things like mental illness and many chronic complex illness and addiction in adulthood. And this really narrow approach that we've been taking, ignoring this biopsychosocial model.
It's such a complex issue because medication can be so bad for kids. Huh? And I basically think that the millions of kids who are taking medication, the antipsychotic medication, I think we make it impossible for them to ever function fully as adults because we interfere with certain brain maturation issues. But at the same time, are there enough places where people can actually take care of these kids, where they don't need to be shut up and made to behave? And so that we have enough of a comprehensive system of care. And so what's interesting is that countries like Norway, Sweden, Denmark, Finland, Holland, to some degree, Canada, to some degree, Singapore, are paying more attention to these things. But the US is not one of them.
Right.
It's how the studies come out of the US, and the treatment method comes out of the US, but they don't get applied on a large-scale basis.
No, I think there's the power structures in place aren't allowing this to take place. Profit centers around pharmaceuticals and so on.
So, I think we should be careful with baseless optimism.
Yes. I agree. Well, we're trying to raise awareness, like by doing things like this, right? Is there any final things that you want to share or say, especially maybe to the health community? That, I mean, I've been trying hard to get the word out. I mean, I start with ACEs just because the data is so huge, and I'm trying to sort of get the information because people still don't consider trauma, how trauma's affected them, that how that is linked to their illness, that they have this chronic illness that is potentially has a huge contributing factor is coming from trauma. So, and practitioners haven't even been assessing for it. The functional medicine practitioners, they give these glib recommendations: reduce your stress, go and do yoga. It kind of paying lip service.
So,
yes.
I think we have covered a lot, actually.
Okay.
I think anything else I would say would be totally overwhelming to people.
Okay. Okay. Well,
Okay.
Dr. Bessel van der Kolk, thank you so much for spending the time with us. You're a hero to many of us, actually. You may not know, but I quote you all the time, and a lot of people in our community are increasingly aware of the brilliant work that you do. So once again, thank you so much for your time and being part of the podcast.
Take care. Okay, bye-bye.
Thank you. Bye-bye.